And I think when it comes to efficiency, it's also something about the kind of like how efficient the medical system runs, right?
Oh yeah.
And it looks like, well, do you want to basically share a little experience about the medical system, how it runs in Taiwan at a low cost? Yeah, is it still efficient right now?
Like the system is kind of like a social insurance system. So like we pay the government a certain amount of money every month, and then we can go to the doctor at a very low cost. I think it's around like 200 NT dollars, which is 10, probably not 10 USD, like 8
It's
USD.
just one cup of coffee right now.
Yeah.
With
Just
all the inflation's going
to
up.
see a doctor.
Wow.
Yeah. But like I would say like because.
So how long does it take for you to make appointment, and then after appointment, how fast can you just get the doctor? Is it kind of like you make appointment tonight and you can visit doctor tomorrow? Is that efficient?
It's like there's a lot of clinics like everywhere in Taiwan. So
Wow,
like
great.
basically if you feel sick, just
go
drop
there,
by
shows
a
up,
clinic. Just
and
show
then
up.
show them your insurance card.
Yeah,
or
just show them your card, healthcare
wow.
card, and then you just get the doctor and the medicines you need, and that's all. And it costs like 8 USD.
Wow, that's really great. Yeah, because in the United States, we have different insurance companies, the medical insurance companies. Yeah, and some kind of like, I think some clinics, they only accept certain kind of insurance. And so it's not like you show up there and then if they don't accept your insurance, and then you have to pay everything from your pocket. Yeah, which is a lot of money. Sometimes just for flu or something, you're gonna pay $500 or $1,000 for only just talking to the doctor for 15 minutes, and then they're not helping, but you still have to pay for that talking for 15 minutes. And a lot of times you also need to probably to make appointment maybe 2 weeks prior to your doctor visits. And you make the appointment today, you can only visit the doctor 2 weeks later. And at that time, maybe your fever or your flu just got kind of like, it just goes away. Yeah, so without taking anything or doing anything.
Or maybe you die.
Yeah, that happens. Yeah, right. Yeah, but I think the thing is, it's really not efficient in the United States. It takes a lot of time to make appointment. You need to wait for quite a long time. It depends on what kind of insurance you have. And also the doctors are not helping, because they don't see a lot of patients. They don't have a lot of experience. And then they probably sometimes they just give you the wrong diagnosis. So what's the point of basically waiting 2 weeks, spending $1,000 and getting the wrong diagnostics? Yeah, and why don't you just basically talking to the ChatGPT and then get something almost for free instantaneously? And so I think that's the reason why I think the CEO of United Healthcare, a young person, CEO of the insurance company, who's really known, that insurance company was known for denying a lot of those medical claims. Yeah, which means that a lot of people, they have the insurance from the United Healthcare, and then after they pay their bills, or they kind of like they want insurance to pay the bills, the insurance basically denied their request, and so a lot of times they pay the majority part of the medical expenses, and so they kind of broke a lot of families. Yeah, and so a lot of people was really mad about that insurance company, and so finally some people just showed up. I think that's the perception. Yeah, but it looks like Taiwan is kind of like it's doing a really good job. Yeah, kind of like protecting, kind of like ensuring that everyone gets the equitable
healthcare.
Yeah, healthcare.
Yeah. It's like they're doing quite well, but like to be honest, they're also like almost bankrupt the system. So yeah, they're trying to get more money from elsewhere. The healthcare system is working quite well. Like
It's cheap, it's fast,
Yeah.
it's getting its job done. Like what you just mentioned, getting the hospital built up in 10 days.
Maybe why do you think like that's not working in North America?
Maybe there's so many interest
behind the healthcare system.
Yeah, and those interest groups, they are segregated, or the better way to put it, they are fragmented. Yeah, which means that some interest group, they wanted to basically to sell the drugs for higher prices, and some groups, they wanted to basically get more money from the people to pay for the hospitals, and some of them wanted different things. People want different things, they couldn't get aligned, and there's no one, or there's no communities, or there's no people, no leaders that's standing up for the patients, right? Yeah. And I think probably just kind of like all the interest groups, they're fighting for their own interests, yeah, for their benefits, yeah. But what about the people when they get injured or they get ill, and then no one seems like care really much about them, and the system, it runs really long. Yeah, kind of like this kind of system has been there for maybe 100 years, and so it's really hard to basically to break the old system and then get a new one. It's already been there for 100 years, and so how would you reform? And I think there might be some proposals in your states trying to get the prices down, getting more efficient. But every time some proposals comes up, and then there's always some interest groups, they're kind of trying to lobby the Congress, and then trying to make sure that what's going on stays, yeah, because they don't want their cheese to be touched. Yeah. But I think one thing really interesting about Doge, yeah, is that some people just talk to Elon Musk saying that the reason why the stock price for Tesla is dropping is that you touched other people's cheese. Elon Musk says that those cheese are not for those people, those cheese are for the United States. Yeah, and so I think if the Doge can do something about the medical system in the United States, make it cheaper, and also make it affordable, make it fast, make people have really easy access to the medical systems, and then I would be all for him. Yeah. Yeah, but otherwise, yeah, and I think, it's good to cut some government spending, yeah, but I don't see any benefits. There's nothing in me. Yeah, he's not giving back a portion of the money to me for what he's doing, but I think the medical systems, it really needs an overhaul. And
to be fixed.
Yeah, to fix some of the issues that we have right now. Yeah.
I agree.
What about Canada? Kind of like you've been living here for a couple of years.
Yeah.
And what doctor would you see when you get sick, or you just wait until it goes away?
We do have a free healthcare system where it's usually you get a card in British Columbia, which is our state or province. We've got a healthcare system called MSP. I don't know if it's called a medical service plan or something, where generally you just, when you're sick doctor, you show your card, and everything will be paid by the government. But you do pay a tiny amount of money when you go to a lab to get your blood test done. And or maybe when I go to see, also when you get this prescription, to get some antibiotics, it maybe cost around for me like a $20 or $30.
2 cups of coffee.
Yeah, for expensive coffee, maybe 6 cups of Starbucks or something like that.
Okay.
But overall, Canada also has its own problem in healthcare. The first is the lack of supplying doctors. I don't know if there's a special interest there, or is they're heard that a doctor form an association that can control the amount of people each year to become licensed. I'm not sure if that's
I see the point in that. Yeah, I also heard similar things about the short supply of doctors in the United States. Yeah, and you can just imagine this in the economics 101. It's like the supply and demand, right? And if you control the supply and you have the same demand, and the price will basically, for the people who's already in the job market for the medical system, they will get paid more. Yeah, because there are limited supplies, and each people can charge more.
Right.
So let's say if there's only one doctor for a community of 10,000 people, and then he can say, okay, for each appointment I can charge $100. But if there's 10 doctors for a community of 10,000 people, and each doctors, they are just competition, right? And everyone can say, okay, I'm happy to charge $10 for each appointment, and they're competing with each other. There's still same amount of the patients coming to the doctors, because people just basically get sick, no matter how many doctors they are, right? Yeah, but the patients get more choices. Previously was only one doctor, he can determine the price, but now there's 10 doctors, and so he has more freedom to choose. And so I think the supply and demand that's created basically that's leveraged by the Doctors Association, it might be a part of the reasons why it's really kind of like the limited supply.
Yeah, so hard for many people. So hard to see a doctor and so hard to see a good doctor, and that's why.
Yeah, maybe they also basically have a say over the standard for those medical schools.
Yeah.
So let's say the Doctors Association, they say you can only get into medical school if you have a 4.0 GPA. So they can probably use those kind of measures to manually create the short supply of the doctors. They can basically say, okay, we want the doctors we only want the good students to be the doctors. Because they can just came up with something like, doctors are really important thing in the society, and so we only want the best people to take care of your healthcare, right? Yeah, but the thing is, I don't see there's a difference between the students graduating from 4.0 and another guy graduated with 3.5. Yeah, maybe the 3.5, he or she...
General doctor.
Yeah, she's kind of like more street smart, right? He knows how to snowball. And the kind of like who graduated with 4.0, he put all his time into study, right? Yeah, so we trans better. We just couldn't just kind of like, we need to evaluate holistically to determine some people. Yeah, but if you just manually raise the bar, and then only very small portion of the students will be qualified, will be eligible to get into the medical school, and then kind of create this self-supply. Yeah, maybe I think this is also part of things like there's different interest group in the Western society, and maybe kind of like people only see what those interest groups want them to see, right? Yeah, people are just kind of like, I think brainwashing also happens here in the Western society. And so basically the social or the medias, and they also basically only showing the things that's politically correct. Yeah, and then they can sugarcoat everything that happens over here with the best justification that they can come up with. Right.
I find like in Canada or in North America, people want to become a doctor because of the good income.
Yeah, I think it's a very prestigious
job
career, and then the doctors, they're really well respected in the society. And maybe this kind of perception is also created by the media. That's also supported by some kind of interest group. Yeah, we just don't know what really happens, or just kind of like which is egg, which is chicken, or whatever is going there. Yeah, but I think, it's kind of like, I think especially going back to the topic for the first generation immigrants, I think a lot of parents, the first generation immigrants, they want their kids to become the lawyers. Become the doctors, like what we just say. Yeah, because I think we are also kind of like, got those kind of ideas probably from the media, right? Yeah, saying that doctors are good, they earn good money, they're really respected by the society, and then they also kind of like can help people who are in need during those bad situations in their health. And so I think it's a really interesting things to see. Yeah, how we also want our kids to be doctors.
Oh yeah, and also when you're getting old, you're more valued in society, like in legal profession or Medicare. Yeah. Because your experience is built.
Yeah.
But I don't know, like
your reputation is built in the community. Probably. Yeah. All the neighborhoods, they know that. So let's say you're the
old doctor.
Right. They know that kind of like, okay, you had already fixed a lot of their medical problems, and so they got more trust in you, and so the next time they got sick, they wanted to come to your place, and then get treatment from you.
Right. I've never seen like a programmer like in the 50s, and it will be valued or hard, right? Or maybe
it's really hard. Yeah.
really hard, and for generations, like many of my traditional career path, even for accountants as well, or for people working in Wall Street. But when they're getting old, like they had the money, so they don't need to work. But for some, they get old, they can't compete physically or mentally due to the high volume of workload or something like that.
Okay.
Yeah, but for doctors and lawyers, when they're getting old, the experience to get a value for sure, and and also the system support their income throughout the years. But while back in China, like now, many kids they don't want to be doctors now because they paid low. Like they don't get paid as much
compared to other careers.
So that's why Medicare in China is really, really affordable because doctors suffer. There is at least one party. Like on the other side is the general public. This side is doctors. So like it's kind of like a rivals. Like if doctors are more than general public, will pay premium price for seeing doctor. If doctors feel okay, they don't earn as much as they expected. Probably the general public can say, oh, it's so cheap to see a doctor. So it's kind of like one can
interesting dynamics.
Right.
Yeah. Okay.
Right. Also, although Medicare, in terms of specifically pertain to how much you can pay to get your prescription, or those pills or drugs you get from drugstores. I think if you manufacture, this is back to Donald's topic. If you manufacture the pills or the drugs in the States, will it make it cheaper or expensive for the general public? That's a question. But there comes with questions that if you want a cheap, drugs or cheap medicine, that's a very important thing. But also in terms of drug development, like they got pharmaceutical companies like Pfizer, those companies they went through lots of clinical trials, like stage 1, stage 2, something like that. That spent like a hand or 10, or at least $10 million US dollar on it. They recruit patients, they test you, they pay you money, and the development, the in vitro or lots of development happening in the lab. That they hire lots of professionals doing the job, and that also that's very expensive, and the company definitely want to get their return on their investments. But on the other hand, I think it's also if they outsource the drug research to other countries, that might make it more affordable. That's one hand. So whether you want to outsource your development to other countries, this is a very important question. And also in terms of drug, I know like there are many countries that start to tax their drugs outside their country, like outside the States or outside of Canada, but still like drugs are very expensive, like maybe one pill, and it doesn't get insured, and it got like maybe $100,000 for one pill or something, I guess. So that's a very important factor to consider. But in China, then they are affordable, like those pills, and also for also our labors, are much cheaper. Like in India, the much cheaper, and they can develop lots of like cancer treatment pills.
I heard there is a really popular Chinese movie.
Oh yeah.
Called
I'm not the god of the medicine.
Right. Yeah.
Is about a patient who are diagnosed with cancer, right? And he found like many big pharmacies they charge a very expensive price for the pills or drugs
from the United States or from the Western country, but he can get much cheaper from India.
So he
smuggled that into China, and so he was risking his life. He was risking a lot, because it was illegal back then,
right,
to do the smuggling for the drugs produced in India. But he's doing that for the good of his fellow patients.
Right. Yeah. For his patient diagnosed with cancer.
Yeah. For
society.
the kind of like for the patients, for the communities. Who suffer the same. Yeah. So I think at the end of the day, he pushed the agenda for China to legalize basically the replica from India.
Right.
Yeah, to allow them to use some cheaper drugs to kill their cancers or kill their diseases. And so I think that's also speaks to what's going on. It's crazy to pay for drugs here,
in the north
West,
one.
in the northern societies, but it's cheaper there. And then how people can make some progress, or just can make some changes,
Hopefully, honestly, because I can't imagine what life would be like when we're,
when we're old.
Oh, we're old.
Everyone gets old, and so at the end of the day, we will be concerned about the cost of healthcare.
Exactly.
Whether this is still affordable in the Western country or it's better in the Eastern countries.
Or move to Thailand, Save your 401k, move to Thailand,
Let's go.
Let's go, yeah. I mean, yeah.